at least 4 symptoms from any of the following categories, observed at least weekly over a 6-month period. Angry or irritable mood is the first category. Often loses temper, is often touchy or easily annoyed, is often angry and resentful. In the second category, argumentative and or defiant behavior, often argues with authority figures and adults, often actively defies or refuses to comply with requests from authority figures or rules, often deliberately annoys others, often blames others for mistakes or misbehavior. And the final category is vindictiveness, has been spiteful or vindictive twice in 6 months. Remember that the symptoms must cause clinically significant impairment in social, educational, or vocational activities. This disturbance is not solely due to another diagnosis, for instance, psychotic disorder, substance abuse, or depression, and criteria not met for conduct disorder. Now, following up on that, just want to review something we've talked about before, diagnoses that don't go together. So, for instance, if you're diagnosing ODD, you should not be diagnosing antisocial personality disorder anyway, because that diagnosis doesn't kick in until someone's 18 or older. Other conduct disorders is compatible with ODD. And my least favorite is the unspecified disturbance of conduct. You either have the ODD or you have this. This diagnosis is used for disorders that are characterized by conduct or oppositional defiant behaviors which do not meet the criteria for ODD or conduct disorder. A patient cannot have both ODD and unspecified disturbance of conduct. Please remember that, because when I see that, then my symptoms of ODD kicks in. Next page. And so this is the clinical guidelines and treatment, what that's expected. So there's an expected minimum of 10 visits to a maximum of 24 visits in the 90-day period, which is the episode period of ODD, using evidence-based treatment. And there should be at least 8 family visits among the 10 to 24 visits expected during the 90-day treatment period. And those 10 to 24 can be divided any way you want, whether they're individual, group, but 8 of them must be family, because that's what ODD treatment's all about. And then there is an expectation that 40% of a PAPS episodes improve and remain in remission for 6 months. The patient then goes into remission, or the patient is reassessed and a rationale made for necessitating continued care resulting in a repeat episode. So you either have remission or a repeat episode. At this point, sending it back to James.
Thank you, Dr. Mel. Now, once we understand the treatment and the guidelines for treating ODD, we can then shape an episode around the ailment or condition. And no matter what kind of episode we're dealing with, medical, surgical, behavioral health, all of the episodes have the same dimensions or aspects or elements to them, and these are common. And we're going to go through these one at a time. This will give you a pretty good understanding of the episode, what's included in the episode, what may exclude an episode, and talk a little bit about the quality measures as we go along. First, we need to find an episode. How do we know if we have an ODD episode? And an ODD episode is triggered or defined, the starting of it is defined by 3 medical claims with ODD as the primary diagnosis. So, the computer looks at all the claims that everybody has sent in, all the millions of claims from all the providers in the world, and it starts looking at primary diagnoses. If it finds 3 primary diagnosis of ODD for one beneficiary in a 90-day period, we have an episode. An episode has a start and an end. The start date of an episode in ODD is the date of service on that very first of the 3 triggered claims. And an ODD episode is 90 days long, so then we can set 90 days after that the end date. So once we have an episode triggered, we have a series of time, 90 days, that we start looking at all the claims for that beneficiary, irregardless of what the diagnosis is for that beneficiary. And we start going through those claims, and we then bring in what we call bring in or look at any claim with ODD as a primary diagnosis. We also look at all medication claims for that beneficiary. And since there's not a diagnosis related to or on a pharmacy claim, on a medication claim, we then have to look at the particular classification of the medication to see whether or not it's a behavioral health medication or not. Now, because medication is not necessarily indicated in the treatment of ODD, we do not bring in any of the costs of medication into the episode. But as a quality measure, and we'll talk about quality measures in a minute, as a quality measure to pass, we do examine any of the pharmacy claims for an ODD beneficiary. Once we trigger the claim and we know that we have an ODD episode, once we begin to look at all of the claims with ODD as a primary diagnosis, our next job is to see who is the principal accountable provider. This is the provider who is responsible for, is accountable for the cost and the quality of the episode. Before we can assign a particular provider as the principal accountable provider, what we call a PAP, we have to see and look at, is that provider eligible on that claim to be a provider? Here we have listed the provider types who could be or are eligible to be an ODD PAP. A PCP, primary care physician, the psychiatrist or licensed clinical psychologist, those are the eligible provider types to be a PAP. Now, if a behavioral health organization is listed as the billing provider, then that organization is also eligible to be a PAP. So once we see is that claim from an eligible provider, we start counting the claims for the various providers in the episode. And whoever has the most claims will then be attributed the PAP status. If for some reason there are two or more providers who have an equal number of claims, we have a tiebreaker, and that's the provider with the greatest reimbursement cost will be assigned the PAP. So we trigger an episode. We look at claims that are primary, with a primary diagnosis of ODD. We determine who the PAP is. Now, just because every episode that we identify, it doesn't mean that it will ultimately end up what we call a valid claim. there are business and clinical reasons that we will exclude an episode in your reports. One of the reasons that we would exclude an episode is if the beneficiary was not continuously enrolled in Medicaid during the episode period. Another reason would be if the beneficiary is 5 years old or younger. Another is if the beneficiary is 18 years or older. And finally, if the beneficiary has a comorbid behavioral health diagnosis, that could exclude them from the episode. Now, so far we've triggered the claim, we've brought in episodes with ODD as primary, we've discovered who the PAP is, we determine whether or not an episode is valid or invalid based on those exclusions we just looked at. So that gives us everything that we need to total the cost of a particular episode. But as we talked in the very beginning, not only is cost a concern, the quality of care is a concern as well. Some of the things that we need to determine quality can be gleaned from claims. Some things we have to go to you, the provider, to tell us information about the particular beneficiary or episode to help us determine whether or not you meet the quality measures to pass or fail. The first listed quality measure to pass is based on provider portal entry. We cannot determine the quality assessment or continuing care of an episode without asking you for additional information. Now, later on, Carrie is going to tell us a little bit more about the quality measures and give us some screenshots of the provider portal and that sort of kind of thing. But every episode, well, 90% of your episodes should have either a quality assessment if it's a beginning or initial episode, or if it's continuing on beyond that 90-day period of treatment, then it should also have a continuing care certification. Another quality measure that must be passed is the percentage of new or initial episodes that are receiving medication. That threshold is set at 20%. If an episode repeats, in other words, there's one episode, it starts, it ends. If another episode is triggered by 3 claims after the end of that initial episode, we call that a repeat episode. If that episode repeats, then we're expecting the behavioral health medications to be at 0%. And this is very important. There's a 180-day remission period. We're expecting 40% of your beneficiaries to be and stay in remission for 128 or 6-month period of time. This is very important when we look at reports and determining on how quickly we can get information to you about your particular episodes. So we have quality measures that we require you to pass to be eligible for gain share or commendable status. But there are also some quality measures that we track. And these are metrics that should be useful to you or useful to the Medicaid program about the ODD episode. For example, we track how many of the percentage of your episodes that have at least 10 visits. We also determine based on your portal entry, whether or not guideline concordant care is certified or not. We also look at the average number of visits, and we look at the average or the percentage of visits of episodes that have at least 10 visits, where at least 8 of those visits are family therapy visits. Those things we can find from claims. Now, in every episode, we have this a minimum case volume that is set, that you have to have at least 5 valid episodes to be held responsible for risk or to be eligible for commendable or gain share payments. To me, a picture is worth 1,000 words, and what I've tried to do here is to diagram some of these time frames for you. So, on a little timeline here, we have 90 days. The episode duration is 90 days. As we've just mentioned, an episode is triggered by 3 claims with ODD as primary. The little blue triangles under the line are indicating separate claims, or the 3 claims necessary to trigger the episode. Once the episode is triggered, then we can set the start date and we can set the end date 90 days later. On your reports, you'll see the start date and end date of the episode. So, any of the ODD as primary claims seen by the computer in that 90-day period are considered or brought into the episode. Now, the remission period that we talked about, the 180-day or 6-month remission period. Before we can report to you the quality metrics for an ODD episode, we have to wait until this 186-month period has expired. And for reporting purposes, we've split that 180 into 2 90-day periods so that we can give you additional information during those remission periods as the episode and reporting cycle progresses.